Same thing, the reason we put saline in the body when somebody's dehydrated, we have to have salts. Just like a chain link fence post outside, it's going to rust with moisture and salt in the air, right? Just like with any metals down here near the coast. Same thing with our instruments. If tissue, blood, and everything stays on those instruments and it dries on there, it causes essentially what we like to call rust, or we call it pitting. I'm going to get into what pitting looks like, but I just kind of wanted to get to let y'all understand why it's so important to keep everything as clean as possible, to keep it moist, and keep it in a good environment so that before it gets to the sink here and we actually get all of it off, we're providing a good environment for our instrumentation. Okay, so that brings us to sterile processing, and we've got. And I apologize for the small whiteboard. This is just kind of impromptu, but we've got two big tasks, right? So we have number one, what we just went over. Are the instruments clean, right? That's our first big task here. Is all the blood, bioburden, and everything else off before it comes into this room. So, inspection points for blood. Obviously, in the useful end, right, we're going to look in the blades of scissors, we're going to look in the joint, making sure anywhere that touches the body, or obviously on the outside with the surgeon's gloves, we're checking for bioburden, blood, and any tissue left in clamps, right? With rongeurs, these cut bone. There's going to be bone stuck in there at some point. So checking for that. Suctions, we're using forced water, right, in decon, hopefully in the OR as well, but in decon with our syringes. So cleanliness, that's the first big thing we've got to do. Now, second thing we've got to do, and that's where our team comes in, is going to be, and I wrote too small of a circle, but function. All right? Every instrument now has to function properly after it's clean. So, that's where we're going to begin with our book. So I'm going to ask you guys to open up. We will start on page 2. Actually, I take that back. Let's start on page 1, and we will start going through that. But to test function in every instrument, there's going to be two main points, right? One, the use, or the used end, or the used point. And two, the weak point. I'm going to ask you guys, every instrument that we go through, what is the part that's used and what's the weakest point, right? The weakest point's always where the damage is going to occur, and the used end is always going to be the dullest point, right? So, we're going to start with a hemostat, cryo clamp, whatever you'd like to call it. So, what part's used? What is this used for? Right. If it's used as a hemostat, right, we're clamping vessels. If it's used for a tissue manipulator, it still needs to clamp down and hold, right? So this is used to manipulate tissue. The used point, right, is our jaws. We've got to make sure that our jaws and our ratchet work. All right, so inspection of the jaws. We want to make sure that the tips are right. If it is a clamp with teeth in it, we want to make sure those teeth align. Should it be an Ochsner clamp? We want to make sure that if it's a 1x2 teeth, that they fit evenly and not going off to the side. All right, we want to make sure that our grooves are clean. That's a big part of it. And we want to make sure they align. Okay, so I want to make sure that they're straight, right? One end's not like in front of the other. And I want to make sure that there's no light, when I have it on one click, that there's no light coming between the two ends, okay? And I'm going to kind of pass this one around because it has been, I think, eaten up a little bit, probably as it's been realigned in the past and over useful time, and you can kind of see where one of the, we'll call it fingers, is kind of a little off. But nonetheless, before I pass it around, the other part of the functioning is going to be our ratchet, right? How do we test to see if the ratchet works?
Tap it.
Tap it, right? One click, and on a surface, not the metal, but on your pads, 2 clicks on a flat surface. We don't want to use the bump of our hand, right? It's not flat, it could kind of get off. On a flat surface, 2 clicks. If this thing pops open, It's up to our team, or it's up to you to kind of pull it out because it's not going to work in surgery as well as the surgeon would like. And it's up to our team to realign that and get it back to where it springs correctly.
The main thing to think about with that instrument, it looks like such a basic instrument, but that's holding somebody's artery closed, right, in the face. I mean, that's a big deal. If that comes undone, and you're talking about, blood loss, depending on, the type of clamp, which artery is being clamped, that can be life or death. So it's that important that we know that this thing is going to clamp shut, right? So just want to add that.
Absolutely. All right. So the functioning points, right? Our tips and our ratchet here. Okay. The weakest point. Where would you guys say the weakest point in this instrument is?
On the tip.
On the tip. Where else?
Joint.
The joint. Okay. The joint we call the box lock. All right. Why? Well, if you turn it sideways, you've got a full piece of metal down the shank and in the rings. Well, this is the same width, and it's 3 pieces, so they're thinner, right? It's also where the motion comes out. It's the joint. It's where all that force is going through. One of the most common things that we see in box locks for ringed instruments is a crack right here. If there's any sort of crack, a little bit of line going through it, that needs to come out. It's going to lead to this not staying clamped. It's also going to lead to possibly breaking, and it's not going to move right, okay?
And another thing is, if it's got a crack in it, how do you clean that crack? Yeah, that's right. There's just no way to clean it. So that's harboring bioburn that's going inside a patient, right?
Right. Awesome. I know this seems as simple as a clamp, but again, the used point and the weak point. We'll kind of move a little quicker as we go, unless you have questions, but I wanted to kind of be really thorough with this first one of what I'm looking for. But tips, right? Alignment. We're going 1 click, 2 taps. We're going to check for cracks. And then we want to make sure it's clean and the motion is good. Is there any questions on clamps? I know it seems really simple, and I know I just talked for like 5 minutes on a simple clamp, but good there? Again, there's all kinds of reminders in your books too about all of these things. All right, I am going to pass this around just so you can kind of see one of the tips. You can see it's thinner than the other just from being aligned. Yes, sir?
I was curious what you think about something like this smudge VSD.
That's a great question. So there is a little bit of a discoloration or smudge on there. So a rule of thumb is going to be in the decontamination area, or even in here, if you have a pencil eraser and you go to erase it and it does not come off, it's just a little bit of the metal being discolored from being in 270 degrees. If it does come off, we consider that rust, and it needs to go to either the repair bin so that our guys can check it out, or if it's pretty extensive, we can just go ahead and take it out. That one though, I would imagine it's just a slight discoloration of the metal. It just doesn't look quite like rust or anything, like any coating coming off. Okay. Great question, though. Thank you. All right. So the first instrument obviously was I guess they're both hemostats, and so what we're going to do is move over to page 5. We're going to move over to needle holders. All right. I'm going to ask a super dumb question. What are these used for? Holding needles, right? Why it's so important, right? Because that gives us our functioning point, just like the hemostat. So I'm going to ask y'all the 2 functioning points. I'll give you the hint is that there's 2.
The ratchets and the tips. And the jaw.
Exactly. The ratchet and the jaws. More importantly, within the jaws, these inserts, right? We want to make sure that these inserts are worn down, and you can kind of see an animated picture and a real picture of some inserts that are worn down. We want to make sure that they're not cracked. We want to make sure that when we hold it up to the light with 1 click, that there is 0 light coming through there.
Through the tip or through the full ones?
Just through the tip right here, through these 2 inserts. And again, I'll pass it around. But you want to go through and make sure, again, it's not worn down, that the teeth still look good, or the grooves, and then that there's no light. All right. Ratchets. How are we testing it? 1 click, 2 taps. Fantastic. This one's good. Okay. Weak point. The box lock. Just like with the clamps, right? We're looking for cracks. cracks, and then we're obviously always looking for cleanliness, right? We want to see if there's any tissue or bioburden left within the joint and on the outsides. And I'm going to use this opportunity because this instrument has some. Yes, ma'am. Yes, sir.
Is that hold true for like this? Is it you just want the tips matching, or are you looking to see that the whole jaw is front to back? Or
So on clamps, I would like to see the distal third. That obviously ranges of how big the tips are or the jaws are.
right?
But I would like to see at least the last 5 centimeters or so with no light coming through.
All right.
So I talked to you all about the cleanliness part, right? And then getting back on my clean bubble over here. Pitting. Pitting is when, like I was telling you, bioburden and the salts of our body and everything else is left on here too long, and just age of an instrument. If it's really old, it just breaks down. Pitting is when we have this very nice, what makes this surgical instrument is obviously a high-grade metal, right? But a passivation layer. So basically what that is it's a protection layer where they did some kind of a chemical treatment on it, and it brought all the iron up to the front. And when that, and it, again, passivation layer, right? When that breaks down, we start getting little dots that you may see in big metal areas, right? And I'm gonna pass this around because there are some, and I'll kind of show you, make the show as we go along, right there on the handle. If everybody will show the next person. When this starts breaking down, we don't know how deep it goes into that metal. Just like with a crack in the box lock, we can't confirm that it's clean, that nothing's living in there. We can't confirm that the steam gets all the way down in that hole. So when pitting starts, if we catch it super early, our team can save it. If it's pretty bad and you see like really dark black dots on there, that's probably done because we just can't get that deep to buff it out, right? But I just wanted to talk about, that's a huge important part on the cleanliness side, but also in functionality to look for is pitting. So, just to kind of review, right? Functioning points is the tips, the inserts, the ratchet, and the weak points, the box lock. And then as we look for cleanliness and everything else, the pitting. But again, it's right there. Like I said, you can show the next person for me. Thank you.
So we've seen those inserts to where somebody will have in their repair bin, they'll have a needle holder, and they'll have a full insert on one side and like a half an insert.
And that insert's actually cracked too, so.
And a half insert on the other side. So the big question there is what? Where's the rest of that insert, right? Yep. So that's huge to be able to look for those cracks, find those cracks, pull those instruments out. We can replace those tungsten carbide inserts. We replace them. So if they're cracked, just put them in a repair bin. We can take care of them.
Oh, and speaking of that thing, so you said you can buff that pitting out?
Sometimes. If it's very, very light pitting, we can buff it out. If
Okay.
it's just starting. If
So
it's been there.
If we look at it with the borescope and it looks like a scene from Terminator 2, toss it out.
And I would say, and before you toss it out, toss it in the repair bin. Let our team look at it just to see. Obviously, they have magnifying glasses a lot more than these or what I use or what we use with the naked eye or even the borescope. They're the professionals. I'm just the weirdo that comes and talks about it. So, but I would say repair bin first before we toss it out.
Okay.
Perfect. All right. On to page 7. All right, let's go over forceps. So, what are our 2 points, right? Our use point and I should have put point of use. But use point and our weak point. So, obviously, our use point is the tips, right? So, a lot of our tissue forceps have teeth. Could be a 1x2 that fits like that, or it could be a 2x3 that fits like that, right? We need to make sure that our 1 or whichever our actual tooth part is the integrity of it's still good, right? Like it's not bent, it's not cracked, or half of it's gone, and it needs to fit really well in those other 2, right? That's the whole point in being able to grab and pinch that and manipulate.
does it have to be seated all the way down? Because like how much is like acceptable?
You know, that's a great question. Yes, obviously our recommendation is that we want it functioning just like it's brand new. So yes, I would like it all the way seated. However, if it's not, I can't say that it's not. I mean, a surgeon could possibly still use it, right? I mean, that's up to them and what they're using it for. But yes, just for all intents and purposes, it needs to be all the way seated. If it's not, it's only halfway down because the metal's been taken off or worn down. Let's go ahead and either grab a new one, put it in there, or put that in the repair bin, and we'll take a look at it. Cool. All right, so that's the used point, right? What would you think the weakest point is here? The teeth? Okay, smart.
I was thinking like, I don't even know.
Let me know when I'm getting warmer.
Yeah.
Down here? Fulcrum point, right? I know, a big word from like third grade geometry. The fulcrum point, and absolutely. So yes, the teeth are because they're the most delicate, they're the most used. But as far as this goes, the weak point's gonna be this part right here, because what do we love to do when we're setting up a case? We like to put these bad boys right there, and depending on the length, you know, obviously some baskets are a little taller, depending on the length and the width of this. Not saying that's the worst practice, because I know every scrub tech across the nation does it, but it does kind of pull this out sometimes when we're really in a hurry trying to set up a case, and you just want to jam that down on there. So, all that being said, look for cracks down here, right? Look for, obviously you want spring back, and you're not always going to find cracks down here, but just inspect that point, right? So, the teeth, and then down here at the fulcrum point. And then obviously we're going to look for cleanliness too.
How subtle are the cracks in those? I mean, is it like an obvious crack, or is it?
So I would say if you turn it sideways, it's going to be more along the lines of you can see where the two pieces of metal have been joined.
Is that
It'll be
one
pulling apart a little bit.
Is that one crack?
No. You got one? Gotcha. So you can kind of see where, and I'm sorry I'm only showing him, but you can see the joint, right? Exactly, yes. And so I'll let y'all pass those around.
So what's the biggest thing about that crack as far as
Bioburden.
fiber? You can't
Right.
You cannot get in that crack. Yep.
And you can see as we talk about bioburden and not being able to clean a piece or a crack, the cleanliness side and the functioning side really go hand in hand, right? Whether it's pitting or whether it's not being able to confirm that something is clean. Is there any questions so far? Awesome. All right, let's keep moving to page 9, please. My favorite thing, scissors. All right, I'm gonna start with the weakest point here. Where would you say the weak point is on a pair of scissors? Box lock, right? This one has a screw though. All right, which is going to be really important as we keep moving through this book. Screws can be a weak point. In the same reason a box lock is, right? It's where all our motion is, it's where our torque is coming from. It's also a thinner metal right here. But we want to make sure screws aren't backing out, right? Sometimes screws get loose. So making sure that this is all the way in, and when we have a screw, it's not rattling, right? A little play is okay, but when you really have like a lot of, you know, our team needs to tighten that screw down so that it moves correctly. All right. Another big thing, the functioning point. Obviously it's scissors. They're meant to cut. We all know what the function is. It's the blade, right? How are we testing for sharpness? Fantastic. I stole yours, sorry.
All right. Another question though: are we testing for sharpness? Okay.
Every time, right?
Every time.
Every time. Okay. Perfect. So, the technique, right? And if we are, one, we're only going to test surgeons, unless it's a bandage scissor. I'll find it in a minute. Unless it's a big bandage scissor and they're not using it actually on the body, every scissor that's used for the body is going to be that last half that's actually the useful point. Awesome. Thank you, friend. This is just cutting towels, this is cutting bandages, right? Clean up after a case, closing the wound. So, with that being said, this whole blade is going to be used, but it's not used in the body. I'm not saying don't test it. I'm just saying that this is not going to be affecting a patient's livelihood. So we're going to test the whole blade on bandage scissors. Now, the last half is going to be what's used inside the body, right? With any scissor. Every surgeon wants to be precise, so we're going to test the last half of the scissor. And what we want to do is we want to cut it down and then try to pull away. If it, just like y'all may have seen, if it falls or doesn't snag at all, the scissor's sharp, okay? If you go to cut and it's hard to kind of pull, or it pulls the band with you when after you've snipped and go to pull away, time to sharpen. Another thing that we're looking for is, if you can get the glare of the lights above kind of right and run it down, if you see any shiny points like that stick out, those are probably burrs, right? Something that we can see under our microscope, but we may not. So if you kind of rotate it and then all of a sudden this little shiny speck comes out at you at the edge of the blade, might be, let's test it. If it's still sharp here, it's okay, right? But that's just another way to look for any big gashes that could have been, because we all know that scissors are only used to cut tissue, right? That's it. So, yes?
Quick question, how much play within that screw is an acceptable amount?
That's a good question. It's a hard question because I don't know how to describe it. Like right here, y'all can probably see, my preference would be that I would like it tightened down as a instrument repair representative. Surgeon may not mind if it's cutting and it's good. And I also see that the screw's not backed out at all. So, it's flush and it's not backed out. This is safe for surgery. We're not losing a screw. It's still functional, it's sharp. This is not gonna affect the case. However, would I like it tighter? Of course I would, right? I don't know. It's a hard way to describe it. It's a great question, but
So it's almost like functionality. Is it still sharp? Is it still cutting? And
Right.
almost, is it still flush with actual scissors?
right, yes. And if there's a good bit of play, yes, sir. Go ahead.
Could we tighten that on our own?
No, I'd rather you did. Normal person would probably be like, yeah, it's a screw, right? We probably could, but even so I don't actually do the repairs, right? I know the service, I talk with our repair team all the time. However, I wouldn't know when to stop. And I wouldn't know when is a good, because they have manufacturer specifications that they follow, and I wouldn't be able to do that, so I would just recommend that we would not. But I do think that, to your question, I know this is really not a great answer, but you would know when it's way too loose.
I understand what you're saying.
Right. Perfect. Weak point, screws, right? Remember that. Screws in almost all the instruments that we're going to be going to is probably going to be a weak point, okay? Hint, hint. And then, obviously, our blade and functioning, right? Testing every time. Good? Awesome. All right. We're moving forward. Page 11, osteotomes. All right. Where is the weak point? Tip. Kind of a trick question. It's also the use point, right? Just like with our forceps. This is a massive hunk of metal. We don't have any weak points through here except for what we're using, right? That's another big thing. Look for pitting, right? Any specks or holes or anything like that. And this one looks pretty good, so bad example of any pitting, which is good. We don't want pitting. Okay, what is osteotomes used for? Chiseling, kind of, right? All right, so this has to be sharp, just like a scissor blade. Now, we're going to look for any gashes, big noticeable ones, right? Don't spend 30 seconds trying to really find a gash. If you don't see it, then let's just test for sharpness, okay? How do we test these for sharpness? We've got the testing booklets, right? I know I've seen it at least in this drawer, but I think they're all around. A lot of them do come off pretty easy, so they may be in the drawer. These little plastic rods on the side.
Ah, okay.
Yep. And I'm gonna let everybody take a chance. I'll pass around, let everybody take a chance on how to test for this. But holding at a 45-degree angle and scraping down. Please watch your fingers while doing this. They are sharp, they will cut you. But scraping down and away from you, you want to see if it puts a line or that you can feel the material kind of cutting off, right? You're not going to see a whole lot of material coming off. You're not going to scrape like a big old pigtail off. If you do, it's absolutely sharp. We do want that to happen, but as long as you are making a mark in that, it will be sharp enough for surgery, okay? Now, I do think that this one does need to be sharpened, but I think this one's probably a little big to do this on. But I just want y'all to all, try and see kind of how it feels.
I'm gonna go this way.
The next one, page 13. While everybody's passing that one around, gouges. It's the exact same thing as an osteotome, right? Just a little bit different shape, a little bit different curve. I'm sorry I couldn't find a physical example to have up here with me, but think of it as an osteotome, right? It's just got a little bit of curve in it. It's used for chiseling bone, and we want to make sure it's exactly sharp the exact same way, right? We want to use it and run it down that plastic rod, and we want to check for pitting. You're not going to have any cracks. This is a massive piece of metal. If it cracks, it'll be cracked in half. You'll know it. But checking for pitting, making sure there's no little specks of any of that compromised metal. Good? Awesome. All right, page 15. And so far, any questions? Or is this useful and helpful?
Yes, very useful, very helpful.
Awesome. Again, everything that we go through in these inspection points, don't feel like you're going to have to get your book out every time, because at every one of these stations is the exact same pictures, just on these mats, okay? So please reference this as we go. All right, curettes. Weak point.
That's it.
The tip, right? Just like the gouge, just like the osteotome, our useful points are our weak point. We don't really have any points of motion, so we're looking for that. What are we looking for in our tip? Well, and I guess that's a really big question. When you look at it, it's a cup, right?
Right.
Does everybody know what it's used for? For scraping bone? Okay? So just like with our osteotomes and our gouges, we need to make sure that it can scrape, right? And it's sharp. We want to make sure that cup's still a cup, right? We don't want it to be flat. It's never going to scrape if it's got a flat edge. And believe me, they will. And we don't want it to be dull either, right? We want to make sure that when that doctor does scrape, so we want to make sure that it's still a cup and that you can kind of see the blade edge all around, right? You'll know when you see a flat one. Believe me, there will be no edge to it. It'll just be straight across. So that being said, how do we test this for sharpness?
With the same device.
Exact same thing. 45-degree angle, and you want to run it down the side of that, or down that plastic rod, and you want to see if it pulls off any material or makes a straight mark. Okay? If it does that, then good for surgery.
When repairing those, once it's not in the cup shape, is that an automatic toss or?
Nope, we can actually, well, and it depends on the how much metal's left, right? If we've repaired it 2, 3, 4 times with something this small, it may be at the end of its useful life. If it's brand new and it gets flat just from use or dull, what we do is that we're able to take a little bit of metal off, reshape that cup. So, and there's no specific uses, right? Every osteotome is different. The sizes make it different of how many times it can be repaired, but it just kind of up to, it's basically the exact scenarios. Yeah.
Okay.
The bigger the curette, the more it can be sharpened
Right.
typically.
So a rule of thumb with that would be, if it's flat, I would just put it in the repair bin. If our team can't do it, they'll obviously put it as a beyond, we call it beyond repair or no repair. But we may be able to save it, so anything that you find like that, we'll move it to the repair bin. Awesome. Any questions? Last thing I want to mention too, when you test all of these materials, obviously the gouge and the osteotome, they're going to have straight blades. You'll know when that material, if there's any left on the blade. Make sure there's nothing left in the cup if there's any of that material that comes off. It could be through just blowing it out with forced air, or just examining with the eye under the magnifying glass. The last thing we want to do is put this in the sterilizer and have plastic melt down onto it, because then it's clear, maybe never seen, and you just never know. All right. Good news is we just got through most of the sharp stuff. we will go over some more, but please, please, please utilize these books. If you don't remember or you don't know, if you flip through this, it tells you for this instrument, use this material. For this instrument, for a lap scissor, use this material. So this is your cheat sheet. Please, every time you have a sharp instrument, please test, and these booklets are here to help you. So, awesome. All right, page 17. Self-retaining retractors. All right, so Wheatlander, Gelpy, what's the useful ends? Tips, right? The fingers, the tips. With the Gelpy, we want to make sure that the tips are sharp, right? That one's not bent straight up, one's not broken off, and the other one isn't. We want to make sure that they are equal and have the exact same angles, right? With the Wheatlander, if it's a sharp Wheatlander, we want to make sure that it has sharp fingers, tips. If it's a dull, which this one is, we want to make sure that they aren't sharp, right? But also making sure that they align when we close it, right? Where would you say the weak point is? Which one? Okay. So, before that point, screws, right? Remember I told y'all that screws were going to be a weak point? So we've got a bunch of them on here. And we're about to have a bunch on this double action rondure. But think, screws. So if you're looking up and down this, we've got a screw point here, right? We've got its rivet back here. We have a little screw down here for the spring, for the finger lock. These break all the time and crack. And then these finger locks, or if they're cracked, you can be up in surgery and this won't go down and it won't, spring back up. So that does get to that next point of the teeth and everything else. Part of the functionality besides the tips and the fingers are, does it retain itself open, right? So we've opened it, and I'm putting a little bit of, we'll call it inward pressure, but outward pressure, and it's good, it's locked in, and make sure the integrity of the teeth are there, okay? So, weak point, screws, right?
Yes.
Awesome. Again, we're checking for bioburden, obviously a lot of moving parts here, we want to make sure it's all clean, and no pitting. I will find a good example of pitting again and show you guys as we go, but out a little bit right there, making sure that, again, this springs back up, okay? Same thing with these, but any questions on self-retaining retractors? Good? All right, moving forward, I promise. We're over halfway now. If I could get you to turn to page 20 and 21, so you'll see a single action on the left and a double action on the right, rondure. All right. Rondures, what are these used for?
Little teeth.
Cut and bone, right? Perfect. So we've got the useful end, just like a curette, right? But they're just on both sides, and we've got what we call it, like a box lock on each of them, right? So we want to make sure that the cups are cups, right? That they have a blade on it. How are we testing for sharpness with the functionality of each of these rondures? Perfect. So we have our books. Let's see. Very perfect. All right, so index card materials, what it says, this book is actually made, each page is made of the index card material. Another thing, and I don't want you to waste materials, but if you happen to not have any of that, I'd still rather you test a rondure, the sterilization cards that you put in on the outside of the containers, or if you have a business card or something. All the same material, index cards. So what we want to do is, and again, just like scissors, the whole blade is not used. It's the last half, okay? So we want to put in the last half, clamp down, and you heard that click, but I'm still having to kind of pull and tear off. Make sure, please, after we do that, make sure it's not still in there. But you don't always have to hear a click. It may cut so smooth that it doesn't actually click like a fingernail clipper, but what you don't want to do is when you bite down, you don't want to have to like really put your force into it. You don't want to have to twist and tear to pull off. If that's the case, then let's get that sharpened. The other thing is that when you close them, or as you're looking at them, are they all meeting, right? Is there any burrs, gashes, or any places that kind of look like it's been chewed up? Here is a good example. When you go to close that one, you can see it right in the middle of that side. So that's the functioning end. Just like the single action, the weak point there, box lock, right? Just like we learned with our clamps, let's look for cracks. What else? What is a weak point that we've gone through? Screws. There are screws in those little springs. Okay, we want to make sure that that thin metal isn't cracked down there by those screws. Same thing here. Now this is a whole lot of metal. Odds of us finding a crack here, like 0. But we do want to make sure that these screws aren't backed out, right? We want to make sure there's no pitting, and we want to make sure of cleanliness. When we're back there, we want to make sure that we are scrubbing while it's closed so that we can get in this joint, and then obviously while it's open so we can get up here, right? Here's another really good example of a larger, so you don't have to squint so hard, of a blade that needs to be recreated and sharpened. But again, weak point, right? Screws down here on our springs. We want to make sure there's no cracks around that. We want to make sure that kick springs back closed or open. And then we also want to make sure that our screws aren't backing out. Good. And then we're testing on our cards every time. Even if you got a big one like this, same material, and don't be afraid, you know, I know there's little bitty ones over here, but don't be afraid to use those, okay? And you can just kind of take a bigger look at the cup of that and what we're looking for. All right, any questions on rongeurs?
So all of these rongeurs that we've looked at would go into a repair bin, right?
The two that I've just passed around, yes. I would ask that those put in a repair bin, and if we have a backup, let's get it in there, so that the surgeon's not up there trying to cut bone that's not actually cutting. That's more frustrating than probably not having one. All right. Pin and bone cutters. I do not have an example of this. However, do you have many pin cutters? Do y'all see them? So,
And if we,
just for the sake of going over it, the weak points, just like we went over with our double action rongeur, right? Screws, the springs on the screws, and then the functioning point. When you close it, make sure there's not like a hole or a semicircle in there where we've gone to cut a pin that was too big for the size of it, and you really had to crank down. There's a gash taken out of it. Almost every time we service pin cutters, there's some sort of a gash in there. I mean, it's metal cutting metal, so look for that. And then also, we test it for sharpness as well. Does anybody know with what? What material? Correct. The exact same material, index cards. And again, cheat sheets down here at the bottoms of each page. But yes, and we want to do the entire blade, right? Because as you can see in this book on page 23, yes, with most other sharps, with scissors and everything else, they're using the distal end. But with a pin cutter, just like we would with scissors, right? We want to get it all the way up as close to the proximal end as possible, you know, to try to get good leverage on that pin. So you can see, make sure we test the entire blade. Page 23. Good? All right. Pituitary rongeurs. All right. Well, we talked about rongeurs. We know what they're used for, right? But this is a little smaller. Used for arthroscopic cases, things like that. Now, this one, I guess we'll start. What about a weak point? What would y'all say?
Where it slides back. Yeah. Right
Yep. All right. So there are 2 rivets there. Sometimes there's screws, depending on the size of it, but these are 2 rivets. We want to make sure those aren't backing out, right? We started talking about how screws are all very weak points. Again, that's where our motion comes from. With the top rail and the bottom rail, we want to make sure that it's moving correctly. This one kind of has a funky movement to it. It's a little stiff. If you start getting, a rail that has a crunchy movement or it's kind of stiff,
First time they use it like that.
we don't know what's, obviously something is between here, right? It's not moving like this. Now, it could just be that it's an old instrument, but then,
And these are easy
is it
to-
rust?
to-
I don't know. Is it bioburn?
Real biggest-
Possibly. We're gonna, in a minute, we'll flip the page over to some Kerrisons, and you'll see what may live in the rails. And believe me, it can get ugly. So if you have a tough time moving it, I would ask that you bring it to the repair bin so that we can take these rails off and look down in there versus just putting lubrication on it. Lubrication may be a quick fix and get it through that next surgery, but we don't know what's living in there. So I would ask that if you have a tough time moving, let's go ahead and get that to the repair bin. Also, again, just like with our rongeurs, right? We got to test for sharpness. We've got to make sure that the integrity of the cup, it's still a cup and it's still a blade, just like curettes. We'll test it for sharpness. Do we know what we're testing it with? What material? Correct. Index card. Awesome. Any questions?
So I think in the book, is it supposed to just leave an imprint on it, or is it supposed to actually cut out?
It's a good question. An imprint, yes. With obviously rongeurs are meant for bone and everything else. This is a little more soft tissue. This is used for soft tissue, so it's not going to, kind of have that click and take an exact whole bite out. But yes, you do just want it to make an imprint. Awesome, great question. Thank you for bringing that up. Perfect. All right, on to arthroscopy punches. I've got a biopsy punch. All right, kind of the same, right, movement. So I'm going to go over the biopsy punch here. However, just want to go ahead, the testing material for a arthroscopy punch, it's really small, right? Used for for soft tissue in really small areas. It says our testing material is a facial tissue or a Kleenex. Now, we keep that in these booklets. I'm not sure if you guys keep Kleenex out here in the department, and you may not because they went, but again, that's what these books are so important for, right? So just keep in mind on arthroscopy punches, or in all your arthroscopy sets, test for sharpness on a facial tissue, okay? Let's see here. Same thing's gonna go for these biopsy punches as well, facial tissue, okay? But again, with motion, right? We wanna make sure that it's moving correctly, that the jaws actually move with your handles. We wanna see and make sure that our motion point right here, our joint isn't backing out, isn't I guess impinged by anything. And then we also want to check our blade, right? Just making sure that that blade is intact, and then obviously testing for sharpness.
So with the movement, same thing with anything with the movement, with the scissors, the rongeurs, any of these that move. What are we doing here to make sure that they're going to keep moving? Lubrication. Right, with the milk. And what's the milking process here?
It's ran through our instrument wash.
Through the wash. Okay. So we see this in a lot of places. It's great for it to go through the wash. That does help. However, it's best if you get something that's starting to stick, to actually use the milk, before you put it in to be sterilized too, so that not only is it getting hit in the washer, sometimes the washer doesn't do a great job. And that's just, so we want to do it manually and get this still sticking, okay? If it continues to stick after that, now he's probably got something stuck in it. Let's pull it out, put it in the repair. Make sense?
All right, page 31. I just want to show you, I know that don't have Kerrisons here because you're not doing any neuro cases. Is that right?
Yeah.
But just like we were talking about those rails, these are pictures that have come from our history. I couldn't tell you which account or what year, but we would take top rails off of Kerrisons, just like we could with our pituitary rongeurs. And this is some of the things that we've found over the years living inside of there. It can get pretty wicked. So I just wanted to show you all that, to show you that, again, if it's crunchy or if it's sticky with your pituitary rongeurs or items with rails, again, please put that in the repair bin so that we can take that top rail off and just make sure that there is nothing living down in there.
What's the best way to not allow this? Is it soaking? Is it pressure with
Yeah, so I would say with a syringe, right? When you go to partially open this or fully open it, you will see a space between the top and bottom rail, and I can pass this around. As you close it, it closes down itself. But as far as you can, open that rail, and then if you have forced water, whether it's a syringe, I would try to syringe down through there as best you could. And yes, according to IFUs, every instrument soaks for a blank amount of time depending on the instrument, right? But making sure that we're meeting that requirement.
The ultrasonic.
Another great point. Yes, ultrasonic. It can help shake some of that stuff loose as well.
Okay. I've just, at other bases, I've seen this way too much, and it seems like this
Right.
is like a culprit.
Yeah, so you guys don't have Kerrisons here, but we actually partnered with the company and developed take apart Kerrisons because that became such an issue. So,
And Kerrisons are more susceptible to that because, as you can see, there's an end right here, right? Like it's meant to tear, where Kerrisons were kind of meant to bite and pull back, and so it kind of feeds it into that rail. So Kerrisons are the most susceptible to that, and there's a lot more motion with Kerrisons. However, yes, it can still happen here. But again, great point. Ultrasonic, making sure that, and again, I'll pass it around so you can see like that. Okay, great. It kind of closes and the rail opens up a little bit more here. And you can also feel this one's kind of sticky a little bit too. But force water through there as well.
and also just to add on, since we're talking about the ultrasonic, depending on the solution that you use, that actually, we talked about the passivation layer, which gives it the protection against pitting and stuff. So the ultrasonic is important because if you use the right solution in your ultrasonic wash, it puts on another passivation layer to help protect it against pitting. So make sure that's part of your regular routine with the instruments that call for ultrasonic. There's some that don't. So.
Would you say that, I know you kind of give a blanket statement, but you're kind of for all instruments, like not just the ones that actually call for it in the IFU, but say if you just want to throw an item in the ultrasonic, the solution can give an extra protection towards hitting.
Yes. So the only thing is you have to be careful. You can't mix metals in ultrasonic. All right, that'll ruin the instrument. That's one thing. So I say it as a blanket statement because you do have to look specifically at the IFUs for that instrument to see can this go in the ultrasonic.
Okay.
If it can go in the ultrasonic, you really want to do it as often as you can.
Right.
So there's, most facilities that we go to, we implement that's part of their process. It's washed and cleaned manually, it goes in ultrasonic, it goes through the washer, it comes over to the clean side.
And from a repair standpoint, that's how we kind of reaffirm that passivation layer. If we ever have to buff a little bit or kind of sand out some rust or something, we try to again reaffirm that passivation layer through our through the ultrasonic process. It's the exact same thing that you have in the back. So,
But if it's not something you're doing with every set that's coming through, it's something I would definitely explore. It's going to prolong the life of your instruments. It's also going to help get them cleaner because it breaks down that bioburden that gets into box locks that you can't get to. So that's a huge part of cleaning those instruments.
So when you said mixing of metals, I seen a couple eyes go, whoa, what's he talking about?
So you don't want to put
Explain that,
aluminum and stainless steel. That's one of the main things. Or titanium. And so if your baskets are made of aluminum, they're not made of stainless steel, which I've seen, and you're putting stainless instruments in an aluminum basket and setting it down in ultrasonic, they're all going to come out black. Yeah, they're just going to and you'll have this soot all over your hands and stuff. So that's what I mean by don't mix the metals.
Okay.
Does that make sense?
Is there an easy way to spot the three types of metals, or do you have to know exactly which metals that you have?
So most titanium instruments, your baskets aren't going to be made out of titanium.
Yeah.
Most titanium instruments are going to be blue. And then, they're going to be specialty stuff, like cardio, eyes, yeah. And of course,
Which the IFUs will say not to put those in there.
right.
So.
So, not to worry about the titanium. Again, like most of it will be blue, and so that'll be a good indicator. However, the biggest thing is going to be the type of baskets that you do buy, because most everything else is, I mean, your instruments aren't made out of aluminum. They're all made out of stainless. And so that would just be the biggest thing, would be the possible baskets that we're putting in there with them.
Okay.
So it's not as scary as it sounds. I mean, you know, but
Recognition of just being
Sure.
aware, like, I'm glad that you said
Yeah.
that most titanium are blue,
Right.
and most of the specialties, so that kind of gives you a clue of like, okay, just be mindful of what baskets we're putting them in, and
Right.
can it go into the ultrasonic?
yeah.
And then if they do come out black, well, you'll know, hey, this basket's probably aluminum, and I don't need to do it again.
Yeah.
You know, on different ones,
So,
because,
vascular castodial needles are titanium and they are blue, so do not put them in there with the whole set.
correct.
Correct.
And with sterilization too, correct?
So sterilization's fine with sterilizing them all in the same set, because it's just heat and steam. The ultrasonic, and I don't believe I understand it all. It's more than just a little shake. I mean, it is, but it's really like, it really shakes out like the molecules inside the metals too. So
It's your magnetism working against each other.
Right.
Because the whole thing works on magnets, right? So it's trying to change its chemical makeup. So that's why it is potassium.
So, awesome point. Thank you, Josh. All right, so with all stainless, we're about to get in the last two instruments here. And with all stainless, what are the 2 points that we're going to look at with everything? 2 generic points, the
Use point,
and the weak point, functionality and the weak point, right? We're also checking for cleanliness, right? Sharps, please use your booklets. I'm thankful that y'all are one of the only places that I've ever been that initially has the little plastic rods that we can do osteotomes and curettes on. So thank you for that. But please use your books, use your mats for these basic inspection points. And if you kind of forget, just think, hey, what point is used in the surgery? Most of the time it's either your tips or some sort of the distal end, right? But check your distal ends and then check what would be a weak point. All right, last 2 instruments are laparoscopic. So, do I need to go over why it's important for laparoscopic to be clean?
Yes.
Because they're not.
Correct.
Okay, well, let's get the scissors, and I've got a big old cauterizing piece here. So, that being said, do we know if bioburden is living underneath the insulation?
no.
Not here, but fortunately with these, we do, right? Now, because IFU is going to tell us that we need to wash these separate from, and our insulation comes off here. So we need to have 3 parts to this one instrument going through the washer right there, right? And while I'm thinking about the washer, I know I didn't say this specifically, with all of our clamps, scissors, everything else, they need to go through the washer in the open position and not just completely stacked on top of each other, right? All right, I just need to throw that one in there because I forgot. However, how do we know if there's any bioburden living in here? We don't, right? And there is a flush port, okay? So, with forced water, right, as we're soaking and everything else with forced water, we need to make sure that we are absolutely flushing these to the best of our ability, okay? And do y'all, is it just syringes, or do you have like actual,
We have a pressure.
fantastic, good. So, doing that for more than just a split second so that we can make sure that it's all coming. Also, as we are washing and soaking, again, to the best of our ability to make sure there is no bioburden under here. While we're soaking, distal end down, right? Because if any water is getting in there and it is doing its job, if we're holding it like this, it just moves it further back here, right? And if we start flushing, it makes it a longer way to come out. So I know that that's not always 100% possible, but as best you can, if you can put the handles up a little bit more and let gravity help while we're soaking. Cool? But again, cleanliness as best as possible with items that don't come apart, an inspection, and then also with items that do, making sure that everybody's comfortable with how they come apart and are put together, so that we are making sure that there's nothing out of here, and flushing these, please. And then, are we using the borescope to inspect lap stuff too? Perfect. So, using the borescope and making sure that we can see everything that may or hopefully are not living in there. All right. So, cleanliness. Now that I've done that, what's the most important thing about lap instruments? What's the one thing that you've always heard about laps? Is there one thing that you've always heard? Insulation. Insulation. Okay. So when we talk about weak points, right, we're going to follow the same two little concepts, but before I get to use weak points, why is it so important that insulation is intact and fully there with no nicks or gashes? Correct. I'm thankful that each of you you rotate through the OR as well. I hope that y'all sat in on lap cases or scrubbed in on lap cases, because the field of view is only about right there, and there's all of this we get to worry about, right? That the surgeon may not know. So,
you can Google videos and see when the insulation is broken, and you can watch the video and you can see it arcing onto, like on the inside of a patient, see it arcing and actually burning the tissue. So you can really kind of visualize what's happening there. That electricity just going in, just burning whatever it's not supposed to burn.
right.
So it's really important to check for that insulation.
Yeah.
On our truck, we can replace it right there on site. You don't have to send it off. So if you find it, put it in the repair bin, we'll fix it.
Yep. How are we testing the insulation? Music to my ears. We're using it every time, right? Perfect. All right.
Actually, can you demonstrate just?
I absolutely can. Okay, so we've got a whole bunch of options and assortments, but one, you do have again a couple of accessories that can plug in, right? So we have a hook, and all of these. So all of your accessories, you have. I'm sorry, I'm going through this a little crazy. 3 actual items that we can run down the shaft and around the handle should we need to. Okay, we have a hook, and then we have our holes, right, depending on the size, and we have a brush. Now, your hook and your brush, you can use this down the shaft, it's meant for that, but these two things were meant to go around handles. I've got really good news though. You have plastic handles. There's no metal in them. So, what we would run into, and if you've been at other facilities before or anything like that, it's a powder-coated metal handle, and if that powder coating, just like with insulation, if that was compromised at all, these would be able to feel it. But these are all made out of metal. So from what I see and what I've found, none of your electrical capable lap instruments have metal handles. I guess, is that true? Do you think that's true?
I have some that are.
Gotcha.
Yeah, any of those that are covered in insulation, you definitely want to test it.
Right.
The big deal there is you hook it up to the electricity and you turn it on, and it's in the doctor's hands, and it pops up. You can jump.
That's a bad
We
day.
obviously
Yeah.
don't want that.
So I'll start with the handles just so that I can show you in case there are any examples, but I'm a big fan of the brush, and so we're going to plug the brush into the top, right? All of our accessories go in the top, okay? And then you have either this cord that this can plug into the cautery post, like so, okay? Or if there's not a cautery post and you still want to test the insulation, we can use the jumper cables here. So plug in the side, and then you would find a piece of metal, should there not be a cautery post, right? But you would find a piece of metal, or if you lose that other cord, which I hope we don't, but if you do, you can put the jumper cables on, all right? And so what we're gonna do is that I press that and we're good, right? It's on, it's running current from this machine to the cautery post and hopefully only out this end, okay? And how do I know if it's running out this end? I've got it pressed down, it's green. it's beeping, which means that I have completed the circuit, right? So that's what we're looking for. We're looking for the beep. If there's a beep, there's electrical current that's making the circuit. I hope that there is no beeping where there doesn't need to be, right? Okay? So, in order to do it on the handles, should you have metal handles, hold down the screen, run it around the insides. You'll hear it? Nope. And then go all over, right? As best you can. Run it, touch it, everything. Okay? So, metal, no current. All right? And we want to run all over this whole thing. All right?
Yeah. So these are metal, but there's no electricity coming to these, right? Like these are just machines that they're working. The ones that are like this, that are powder coated with the same type of insulation on the metal handle, that's what we're referring to for the ones that need to be tested on the
Again, if you go ahead.
I was gonna say, so there shouldn't be any electricity running through that particular instrument.
If that doctor decides to make that, he's going to have to hook up, basically, if they have a jumper cable option, plug this into the cautery, machine, and then he's going to have to clamp it to here, which is going to go through him anyway. So
Doing too much.
exactly. But again, the jumper cable is kind of if you don't have a cautery post, which again, if you don't have a cautery post, you don't need to be testing it anyway because there's not going to be any. But just in the event you need it. So, brush, handle, good on that part. What I would ask is that we all use the circles to test the shafts, okay? Because while you can use both of these, the hook and the brush, it's just easier to know that you've gotten all surfaces through these circles, okay? So please use that. But what we'll do is that again, our accessory goes in the top, our cautery post plugs in to the side, and now when I turn it on, I just want to make sure that it is working, right? So I want to put it on metal, okay? Right there. And so I want to get past obviously we're going to have metal on the end, right? It's the scissor, it's the cautery's part, but I want to make sure that as we get to the shaft and I'm in the correct sized hole, that as I go all the way down and holding the button as I go all the way down, that I don't hear a beep until I get back to that scissor. Now, visually, obviously you have to do both visual and insulation tester. Visually, I don't want any recession of this insulation on the end. I don't want any chips or anything like that. If you scrubbed into lap cases, there's a trocar and that surgeon pushes it down in, scratches and nicks and all that a lot. And that is where BioBurger can get in as well. So I want to do a visual inspection and make sure that it is flush with the end, and you'll know if it's raised or anything like that, if there's any nicks out of it. And then again, a visual inspection of everything, but more importantly, an insulation test down the shaft. Is there any other questions about testing insulation?
So this particular tester has got like this little 9-volt battery in it. You can shock yourself with it. I did think you could, and I did in service, and the girl did that, and she cried, and I felt terrible.
Actually, I think we had that happen recently.
Yeah, so you can wear gloves that'll keep you from that happening. Just a little magic gloves.
I don't know.
But again, it's just a little 9-volt battery, so it shouldn't endanger you.
And again, this is going to be about the biggest diameter tip that you're going to see, and it will still fit in the large. So
I do have a question.
Yeah.
I think Colonel Wilkins, she had found an instrument that had some, it was right here at this end. What would cause it to be there? You can see like a small little gap in between there.
sure. So heat. This insulation is kind of sucked down onto this shaft by heat. So
Heat shrink.
heat shrink. Sorry, I say shrunk.
Good morning. There will be a Catholic Mass at 11:30 in the hospital chapel on the second floor. Again, there will be a Catholic Mass at 11:30 in the hospital chapel on the second floor.
You have an old instrument that's been in the autoclave a ton. That could possibly be a piece of it because it's just over time. insulation needs to be replaced as well. More than likely, it's not going to be due to use because most of the time, unless it's a massive bariatric case, we're not going all the way to the end, right? And so the useful points are all the way through here, but heat is going to do that. And that's how we re-insulate. So what we would do is we would remove the entire shaft, scrape the old insulation off, and we're going to put new insulation to about right here, or at least way far enough away. And again, over time, over years, we're going to have to do it again at some point, but that's probably where you see that. So, perfect. So that was the longest weak point of any of the instruments, right? Last thing, again, make sure your graspers are grasping, right? Make sure they're aligned, making sure that they work with the handles, especially these take-aparts. We put them back down in there, we screw it all, we unscrew it, everything, but as we are inspecting, we can sterilize these together, if I'm correct, right? Or do we sterilize them apart?
Separate.
Gotcha. Fortunately, with having experience in scrubbing cases, do you understand how to take apart and put it all back together and stuff? Awesome. But yes, just making sure that they work, right? That our rotating mechanism rotates. And then the biggest thing, like I said, graspers grasp, and making sure that works, but how do we test for sharpness of lap scissors? Because I know for a fact that lap scissors get dull.
You buy disposable.
Do we really?
Yeah, we're.
Yes.
Oh, even better, okay. Well, in that case, grab a new one.
That's why I couldn't find it.
Yeah. However, if you get non-disposable, and just for the whole point of this lesson, facial tissue. So I know with all the other scissors, we were looking at the orange band, facial tissue because they are so small. And we actually found earlier in an eye set, super delicate, scissors. If they're really, now, if they're mosquito scissors, right, and they're still 4 inches long, which you have our stuff here, but if they're 4 inches or above,
Yellow tape.
test with, well, and that's a really good point. Do we have yellow?
It's some
In
on
your
the
book.
books, but as far as
Gotcha.
the roll,
All right. Before I get into red versus yellow real quick though, but yes, anything under 4 inches, go ahead and use facial tissue because the blades are going to be super small, and that's either going to be eye instrument scissors or lap scissors if it's under 4 inches. And so,
And while you're over here, you're going to manipulate them, right? I mean, that's part of putting the set together. You want to make sure they work. If they don't work, what's one of the main reasons they don't work? Didn't put them on right. That's one.
could be damaged too as well.
Could be damaged. They could just have a bunch of gunk in them. They could be nasty. That could be keeping it from working. So if it doesn't work, first thing I would do is if you can't see any physical damage, just clean that thing again. Run it, if you can take it apart, run your borescope through there, get it clean. If it's one that doesn't come apart and it's not working, take it out of the set, we'll do it. We can pull it apart, we can disassemble that thing on the truck and get it cleaned out on the inside. BioVerge gets up in there and it keeps the parts from moving. It literally just gunks it up. So.
Scissors though, like you said, red versus yellow, right? Red's thicker, it's the same as orange, and so that's going to be the thickest material. Yellow's a little thinner, it's meant for smaller scissors, but the rule is that if you put your scissor down, and I'm talking the whole length of the scissor, if you put it down and it's over 6 inches, use red, use orange. If it's under 6 inches, which would be like really small scissors, right? Tenotomies, items like that, use yellow if it's under 6 inches. The whole scissor, that is. And then, of course, really micro and laparoscopic, use facial tissue. If you don't know and you're kind of going at it, go for red, go for orange, because if you can cut through red, you can cut through yellow. So that's good there. And then my last little spiel is that whether you're in the OR or whether you're building a tray here, I know that if you're in the cleanup in the OR, you can't quite package a tray quite like this after a case, but please do not put heavy, massive double action rongeurs on top of really small forceps, scissors, and everything else. And please, just be mindful of putting the heavier items and the larger tractors on bottom, and then, our forceps and scissors and all that stuff above those when we have heavy metal trays. And so, but that's the whole book. And we will be back to kind of go over it again to make sure we reiterate and any questions that you may have. We'll hang out here for a few minutes after this, but is there any questions or anything?
So if we do end up needing some lube, do you recommend that lube, and how do we do it? Like, do we spray it on and wipe it off, or?
So you're supposed to air dry all lube. Now, I don't know specifically if that's a good one or not. I mean, lubrication is lubrication.
Ours is the best. So
Highly
that's
recommend
what I
Steris lubrications.
No, we definitely, just whatever it is, we recommend just follow the IFUs of whatever they say.
Always make sure it's a water-based, which Instruments is, and that's so that it will dry in the autoclaves. But then, again, no wiping. So I think most lubricants are you spray on in the joint, give it a little motion, and then let it air dry, and the autoclave will take care of the rest. And so that would be it. But should be safe. It should be safe in here, and of course you're getting it in your washers as well. So.
And then the last thing that I'll add is this is kind of just the passion of what I do. So we're all here to take care of people, right? That's why we're in the hospital settings. We're taking care of people. So my mother-in-law, she had cancer, and she had it in her bones, and she had to go in and have a surgery one day. And before that case, we had the business at the hospital, so I asked them, can I look at the sets before she goes in to the case? And so we took them out to the truck, and it ended up, the case got bumped up, and then we had to set the truck. The surgeon was kind of upset with us, actually. And so, because we didn't know that the case was going to get bumped up. Well, we looked at the sets, brought it back in, and took care of it. And I went and apologized to the surgeon, but then I showed him the pictures from the truck. And the rongeurs that he had that he was going to use, first of all, they were dull. Second, when we got them on the truck and opened that case up, they literally had a piece of bone stuck in the rongeur. So this was my mother-in-law that was going on the table, and that was going to be opened up and used on her. So that was my family. So that was very close to my heart. But you got to remember, no matter what the patient is, it's somebody's family that's on the table. What you're doing here, you're the heartbeat of the hospital. Your job in sterile processing is so important to take care of these instruments and make sure that whoever is going to be laying on the table, that they're not going to get harmed from the instruments that are used on them. So I know that a lot of people get moved through here and you guys get shuffled around. Just take that with you wherever you go, that this is one of the most important places in the hospital. Is making sure these instruments are clean and ready to be used to take care of people. So that's all I had. Like I said, that's my passionate part. But thank you for your time.
Absolutely. And if anybody wants any one-on-one talk, anything like that, please.